This video will demonstrate the use of the Zoll defibrillator paddles for patients with chest burns. Defibrillator paddles should be used only on patients for whom the adhesive one-step pads are not appropriate. You must know where the paddles and gel pads are located in your area in the event of a cardiac emergency with a burn patient. Patients with burns to the chest and/or back where the adhesive pads would be placed should instead be defibrillated or cardioverted using paddles. Please note that paddles cannot be used to transcutaneously pace. Each paddle is labeled with the anatomical location on which it should be placed. One is placed over the apex of the heart and one at the second intercostal space along the right sternal border. Gel pads are required to be placed between the paddles and the patient. The sternum paddle has an energy select button that can be used to adjust the jewels. The apex paddle has a charge button. Both paddles have discharge buttons that must be pressed to deliver energy for defibrillation or synchronized cardioversion. When using the paddles to perform a synchronized cardioversion, the ECG leads from Zoll must also be applied to the patient. To defibrillate, first obtain the crash cart, paddles, and gel pads from their designated storage location in your area. Remove the one-step pads from the cable attaching them to the Zoll defibrillator by pressing down on the tab and pulling apart the connection. Insert the paddle connector to the cable with the arrow pictures facing one another. Place the gel pads according to the package directions. Correct placement of gel pads is one pad at the apex of the heart and one pad at the second intercostal space on the right sternal border. To defibrillate, place the paddles over the gel pads and apply firm pressure. Press the charge button located on the apex paddle. Once charged and the patient safely cleared, administer the shock by simultaneously pressing and holding the shock buttons on both paddles. Between shocks, the paddle should be placed back on the Zoll. To release when needed, press down on the black arrows. After use, paddles should be removed and disconnected from Zoll and the one-step pads attached. The paddles should be cleaned with Sani wipes and returned to storage box. Place storage box in appropriate location on your unit.